Welcome, everybody. I'm grateful for you taking time out on this summer Monday to join us. We're here to talk about the recent transition to quantum with respect to the medical trust. And as you know, CPG has been the administrator of the denominational health plan through the Episcopal Church Medical Trust since 2009 under a general convention resolution. And there have been two main objectives. One was to provide the highest possible quality medical care for our participants, and second, in a way that would help contain the rising cost of healthcare to participants in the plan and to the church at large. So the latest opportunity actually to deliver on that has been multiple years in the making, and that's been a transition to quantum health as a healthcare navigator. The intent is that quantum would help our clients navigate the complexities and increasing complexities of the healthcare system. And that we're very enthusiastic still about the potential for that. But in January, when we launched, we started seeing some problems that were unanticipated. And I know that those problems have caused people a lot of consternation and difficulty. And today we'd like to entertain questions that have been asked. And I've invited Frank Armstrong, our our COO, our Chief Operations Officer, to address those questions. We've been thinking about what would be the most kind of effective way to do that. And we thought a long lecture by Frank would probably not be the best way to spend an hour. So I've also asked our Chief Church Relations Officer, Arlette Benoit Joseph, to do this in interview form. So we've taken a number of questions that you all have submitted to us in the days preceding this webinar. And Arlette will be positing those questions to Frank, and then we'll be answering questions live and through the chat. So before we get started, I'm going to ask Arlette to join us, to lead us in prayer, and then I'm going to turn it over to Frank to begin answering your questions. Thank you.
Thank you, Mary Kate. I will offer a prayer from our Book of Common Prayer and trusting the church to God's sustaining grace and transforming love. Let us pray. Gracious Father, we pray for thy holy Catholic Church. Fill it with all truth, in all truth with all peace. Where it is corrupt, purify it. Where it is in error, direct it. Where in anything it is amiss, reform it. Where it is right, strengthen it. Where it is in want, provide for it. Where it is divided, reunite it. For the sake of Jesus Christ, thy Son, our Savior. Amen. Frank, I'm glad we are able to have this conversation. I would love for us to begin with some context. Can you briefly walk us through what your role is here at CPG?
Certainly. Thanks, Arlette. Good afternoon, everybody, and thanks for joining today's webinar. So, as Mary Kate said, my name is Frank Armstrong. I'm CPG's Chief Operating Officer. So I'm responsible for the operations of our three lines of business: our benefits business, our property and casualty business, and our publishing company. And I'm ultimately accountable for the healthcare plans we make available to clergy and lay employees of the Episcopal Church. So that's the relevance of today's topic. And as Mary Kate said, it's first and foremost to make sure we achieve and meet the objectives of the denominational health plan, but that includes delivering a consistently positive client experience. And that's whether we choose to directly provide that level of service, or when we engage with third parties to leverage their expertise, where we feel that they have a core competency that we can help bring to the table. So we own the end-to-end. I'm ultimately responsible and accountable for the end-to-end client experience. And I'd just like to share that's what we're all about at CPG. We know why we exist. We exist to serve and support clergy and lay employees of the Episcopal Church, and we do that by operating our three lines of business. And I'll just share, because some context for as we go through the rest of this, a little bit about the way we think about things, through our decision making. Everything we do, and I'll let you know, is through this, we call it this value cost lens, because value is purposely first. Whenever we're thinking about the client experience, our programs, and things we make available, we're always looking for opportunities to optimize, to meet these changing needs. And we start with value. We ask ourselves, well, why are we even thinking about this? That what benefits do we expect to realize? And first and foremost for our clients. And then, once we sort of land on there's a there, then we get into, the intensity to deliver, the costs, and those sorts of things. And that helps us focus. It helps us make sure we deliver as expected. So it's my responsibility to make sure we're staying connected to the church. We're listening to what's going on. We bring solutions to the table, and we deliver as expected.
Excellent. Thanks, Frank. So Mary Kate mentioned we've received many questions over the past several months. Some that top the list include, what do we mean when we say healthcare navigation? Who is Quantum? Why Quantum? And also, why did we think it was a good idea for our clients, and for the denominational health plan? How do you respond to those questions, Frank?
Yeah, well, there's a number of key questions there. So keep me on point.
I will.
Mary Kate, alluded to, I don't want to talk for 45 minutes, although I can.
Not today, Frank.
Yeah, I want to start with the last question first, sort of why do we go this route? Why did we do this? Because that's why I teed up before. It's bottom line is because we saw an opportunity to improve the client experience. Mary Kate mentioned that up front. I've been in the healthcare industry for 35 plus years, and a lot has changed, but there's two constants. One is complexity. It's just complex. And then two, it's ever dynamic. It's ever evolving nature of the US healthcare system. And these aren't necessarily bad things, but what that means is the reality of the experience there's just numerous touch points for potential errors and for potential missed opportunities. So as we were thinking about the denominational health plan and things that we can do, we know we can't change the healthcare industry. We can't stop all errors, but we did and still do want to do more to help our 22,000 plus members that are in our plans to manage these realities. And we went right back to that value cost lens of the healthcare navigator. These solutions have been out there for some years. We've been paying attention to them. We're seeing how they're going, and we were saying, well, how's this going to play out for us? What benefits do we expect for our clients? And we conducted research. Our goal was, okay, let's find an organization that'll serve as that central point of contact for our members, because we want to enhance our ability to help our clients just navigate in this complexity. And that's sort of enter Quantum. That's where Quantum came into the picture. I'm going to answer sort of healthcare navigation and Quantum together, because they are sort of one and the same. Where that's why Quantum exists. They created their business around healthcare navigation. And I would say, starting at the top, overall value is to help members, one, manage through those complexities of the healthcare system, but also to optimize the benefits and other programs that their clients make available to our members, and basically get the care that you need, make it easier to kind of cut through the noise. Quantum has a team of what they're called care coordinators, and they built that team together on purpose in these pods to help to work together. And these are nurses and other clinicians. They're benefit experts. They're claims specialists. They're people that just know the healthcare industry. They've come from different, walks of that industry, but they're familiar with the terminology. They know provider practices. They know insurance company lingo and processes and procedures, and they know the specifics of our plans. And, that they are that sort of one place to turn to when members have questions. And I just want to talk through some sort of specific examples of that. Some are basic type of things, but questions around claims and billing. And I know we've had claims and issues around that. It's sort of they're there to help kind of cut through that. But it's also about setting expectations. So if I'm thinking about, there may be some sort of provider or service that I need, but I want to think about that a little bit more. I should reach out to Quantum, help me understand what's covered, what's not, in terms of the details of our benefits. Some of the services may require an approval. They'll make sure that, they'll reach out with doctor, pharmacy, or whatever to make sure those approvals are in place. Are there network providers in my area? How can I help maximize the quality of my care, but also the cost? So, I'll want to know what, if I go this way or that way, what costs might I expect? They'll help kind of think through all that. So I'm making informed decisions and I'm going forward, with that. And then, for a health condition that I may have, or if I'm recovering from a hospital stay, they're there to help prepare for that during and afterward, help manage through the conditions, through the stay and that sort of thing. And I would say the last piece that I look at is, and that we expect, is they're going to optimize the value of everything we make available to our clients. And that's sort of that like one-stop shopping, on their website, and also their care coordinators. They know the other programs that we make available and resources, and we want to feed them and channel them through Quantum so that we optimize them. Things like Hinge Health, which some of you may be aware of, that's our virtual physical therapy program, our cancer resource program, that we've got very specific resources, especially for sort of rare forms of cancer. We work with the City of Hope, just to make sure this is sort of like a provider to provider discussion, to make sure that, the local, provider community is staying in touch with some of these new developing treatments for some of these rare forms and that. And teledoc, virtual doctor visit. Those are just some examples that we want to make front and center and optimize the benefits of that. So I spent some time, I guess, explaining what Healthcare Navigator is, Quantum. Hopefully that helps a little bit, but there is a point of clarification. I think still a little bit of confusion around what Quantum is not. And Quantum is not our health plan. It's not your pharmacy provider. It's not the claims processor. We did a lot of work up front to try to make that clear, but there's still opportunities for us to make that more clear of what they are. And, we still have the health plans. We still have the Anthems, the Cignas, the Kaisers of the world. But Quantum does work alongside those companies to answer questions, to help resolve issues, to help just create a better client experience and simplify things. I will say, as Mary Kate said, we're very optimistic. Quantum's a proven and tested solution. Strong endorsements from clients, including some of our peer denominations. We spent time really unpacking this stuff with very good success stories for our members as well. We'll talk more about what's not going well, but overall, this is a program that we feel good about, and our focus now is on optimizing that value for all of our members. So
from what you've shared, I think so. From what you've shared, Frank, it seems like the vision behind Quantum is really strong, with the intent of elevating the member experience. How about you talk a little bit about how that's going so far?
Yeah. So, this is the blood pressure check moment, you see here, and I'm serious about that. There are parts of this implementation that went exactly as we expected, everything I just described, but we encountered unexpected difficulties with the implementation, and in particular with the out-of-network claims submission and reimbursement process. And bottom line, that part did not deliver as expected. We did not come through there. In fact, it is almost the opposite of the intention as it relates to that out-of-network claims experience for some. So, that especially concerning and disturbing to us and, me personally, because, we have taken very purposeful steps over the years to address provider network gaps. We've made decisions and continue to make decisions that are sort of counter to industry norm and things. And it's because we know, because of where our members live and work in certain geographic locations, and or just the services they need, there are gaps in network providers. There just are. And we want to make sure when those gaps exist, we want to do more to make it easier to access those non-network providers. So we've done things like we reimburse at a much higher level. We've introduced Teledoc. Again, it's, might not be right for everybody, but it is a virtual provider, if you need to get somewhere quick and if you can't travel a long distance. And we do that at no cost to the participant. Again, these are really against general industry practice, focus on optimizing in-network utilization. That's sort of the industry, focus, which is ours too. Of course, we encourage that same thinking, like make informed decisions when there are high quality providers in a network that are easy to get to within, proximity. We want our clients to be aware of that to make sure they make informed, high quality, lower cost decisions. That helps everybody. That helps me. That helps, anyone who's looking for care, and it helps the overall program. So, but when they don't exist, when those gaps are there, we want to make it easier. We want to make it easy for our members to get to these non-network providers. And that was the same intent for 2025. They wouldn't change anything for that, which is why, I was saying it didn't play out as expected, and it's painful to our clients. I know that it resulted in an unintended negative impact. It's created both frustration and I know financial burden. I don't feel good about it, and I apologize for that stress and the frustration. I really wasn't joking about the blood pressure moment. People ask me a lot when I'm with clients. At some point, somebody will ask, "Well, what keeps you up at night?" And I was like, generally, I sleep pretty good. I say, but like this one's keeping me up at night. This is one where it has taken us some time to figure this thing out, and I've been involved. I will remain involved. Our team is involved in engaging to identify, address, and fully remediate this thing. So we're all in on this, and I apologize that this did not play out as intended for out-of-network experiences. I mean, I want to spend this time just a little bit more context around, your question around, so sort of like, how did the implementation go? Some of my things are sort of high level. I want to share a little bit of a time frame here. Everybody, we've all lived, in this time frame, but from our perspective, sort of, what we've seen and when and actions we've taken. And I wanted to start out with the beginning, January launch, and back to sort of what to expect. First I want to highlight, what remains the same. As I mentioned, health plans, provider networks, like no change in that. We have Anthem, we have Cigna, we have Kaiser, sort of thing. The Kaiser's a different model, so Quantum doesn't associate with the Kaiser plans, but for Anthem and Cigna, it does. But the vendors and the provider networks didn't change. And nor did our plan designs or our coverage levels. They largely were the same. I mean, there may be little tweaks here or there, but there was no major significant changes to our plan designs or our coverage levels, particularly with out-of-network experience and coverage levels. That there was no decisions made to change that stuff, which is why it's more frustrating to say, like, sort of how did this happen? And I'll get to that in a little bit. But there are two new things that our clients are experiencing, and they're both purposeful. They're both known. The first is Quantum. Again, as we talked about, that central point of contact, that value add to the equation. And this is for Anthem and Cigna members. Now, in order to roll this out, working with Anthem and Cigna, we had to move from their the prior claims engines into these new, more state-of-the-art, innovative claim engines owned by these companies. So Ameriben's the name for Anthem, Allegiance is for Cigna. These are both subsidiaries of those respective organizations. So Anthem owns Ameriben, Cigna owns Allegiance. And again, so the expectation here as we're moving into this was this should be seamless. These are innovative, high touch claims engines. It's change, and we know that, so we want to spend time on it. But if anything, it should be an enhanced experience. So now we move into June, and initial signs are really good and strong. Early engagement with Quantum, and thank you for all of our members, because because you lean in early, and the engagement that we all had with Quantum exceeded their normal sort of when they bring in new clients, and that means both logging onto the website as well as calling the care coordinators and just kind of getting into what is this quantum, let me experience it, that sort of thing. And we had very positive feedback, strong, not only just engagement, but also strong scores in January into February. I will say a lot of those same positives exist all the way through, but we get into February, we started hearing some noise in the system. We started hearing some issues, first about the out-of-network claims process itself. And this was largely with Anthem members that we were starting to get wind of. This is a different experience. This is not the same paper process, like, whoa, what's going on here, sort of thing. And so we leaned in, we're like, okay, this was great and unnecessary delays. And, we had conversations with Ameriben, like, listen, well, we need to understand this better, and commitments right off to put in stopgap solutions to say that we cannot, this is not, this cannot be the new norm, sort of thing. And so we worked quickly with them, within the realm of the healthcare industry, to put in at least, these PDF, these electronic, still has to be downloaded, but then uploaded and sent emails. So we kind of moved away from the snail mail sort of thing to say, let's get this out there, and commitments that we will get to the true e-solution, from American, but let's do something as quickly as we can. And that's where our focus was in February, March, and into April, just staying on point around the stopgap measures. We did find out pretty quickly there too, that even in that quick solve, the PDFs weren't fully, I'll just call them machine readable. So that just means that certain things were kicked out, which was not good. And members would then have to either recode or, just adding to the delays of things. And so we'll talk a little bit more about where we are. But then in May, we started hearing more about reimbursement amounts, that people, our clients that were having similar services in 25 versus 24, they're like, I'm paying more than I did back then. What's going on? Send it us now. Again, some of this could have been to timing, that if somebody has the same service at the end of 24 and they already threw their deductibles and stuff like that, their out-of-pocket would normally be lower. If they do the same thing in February, they may have to meet their deductibles again. We're looking through this, but it's pretty quickly, we're like, that's not it. There's something more here. And that's when we realized we're dealing, in my words, a compound fracture, and I use that internally. My colleagues know what I'm talking about when it's sort of like, that means to me is we got something complex here. This isn't service level stuff. We need to go in deep, and it's going to be more painful and longer to heal. So we got to all in, figure this out. The reimbursement piece too was impacting Anthem and Cigna members. So we're like, okay, now, that piece of it is not contained in that sort of thing. So we engaged our vendors, our contacts, confirmed, all right, these are the issues. We escalated to leadership. We're talking with presidents of these companies to say, what is going on? What's the root cause? We identified them. We began our remediation efforts, and true commitment to say, we're going to fix. On Anthem, we're going to fix the process all the way through. And in both organizations working with Quantum, we're going to make all these corrections to the reimbursement amount. So, we are on the right path. I mean, I will say our recovery has been rocky and slower than I would like, but we're making material progress. There's more work to do, but, we're going to get to the other side of this. I can tell you that, we can see the light at the end of this tunnel, and we're focused on achieving that intended client experience.
Okay. Thank you, Frank. Do you think we have a good grasp of what happened in this situation, how it unfolded, and the financial implications for our members who were impacted? I'd also like for you to touch on exactly how many members we have. Correctly, I don't want to quote a number that's inaccurate, and how many were affected, or how many claims we're talking about that this affected.
Yeah, certainly. Yeah, so your first question is yes. We do now have a clear understanding of the situation. And as I mentioned before, it did take some time as I sort of walked
Hmm.
through that timeline where we were focused on process and getting there. As we're starting to see now, there's something else going on. Um, I will say with a change of this magnitude, so we're introducing a whole new this point of contact for our clients, and we know we're changing the claims engines. That means there's a lot of coding that's got to happen. These are still the same health plans, but we had to get stuff out of the current claims engines to another one. We spent a lot of time up front, reviewing designs, making sure to the extent we could get everything double, triple checked that things were
Hmm.
coded correctly. We had a planned burn-in process that includes these post-implementation audits, which means once we go live, that we hire a third party to start looking at things, not a deep dive on claims audit, but sort of
Hmm.
like, okay, at least surface level and a little bit below, are things happening as intended? And from those, we did uncover a few what I would call typical types of burn-in issues, and they were again focused on these type of areas that we made purposeful decisions to do things differently than the norm. For example, I'll give you a few um,
Hmm.
with in-network diagnostics, so X-rays, lab work and stuff like that. We have always we've made the decision years ago and continue to say we don't want the deductible to apply to that. Yes, co-insurance may kick in, but not first dollar deductible. As it turned out, it was coded for a lot of these. There's a lot of different procedures, so I can't say that every one, but on certain of these procedures, it was coded as that they were subject to deductible. So
Mm.
um, that's something that's fixed, and we need to kind of go through that. And then for certain things that we have always said are preventive, like an example is there like sonograms. So for a mammography or a mammogram, some members need sonograms, and we've always covered that as preventive. The rest
Right.
of the industry didn't necessarily do that,
Hmm.
except now that's sort of changing. We kind of some of that slipped back to diagnostic test, which means co-insurance would hit versus preventive, which is no cost. We made that fix and found that early in the year. I'll give you another example. This is on behavioral health, again, in network. We made decisions that for in network behavioral health, although these are specialty providers, the copay should be at the primary care, which would be the lower, say $30. In some of this coding systems, they were in there as specialty because that's sort of normal, in claim systems and that. So we found some of this, made those corrections. But the main systemic issue, continues to be this out-of-network claims, that this sort of what I will call this unexpected stumble.
Hmm.
And I want to spend a little more time around your question around, okay, help size that up.
Yeah.
What's the impact? What's going on there? And I want to start with the process because again, the process changed for our Anthem members, and
Hmm.
that's regrettably, but um, it did not for Cigna. I mean, the Cigna members still, it's a full, like sort of that solution that we'll get back there on the Anthem side, but there's still more work to do. There's some volume here. There's about 40 out-of-network claims a week that that Ameriben, gets, and that's, so you think about it, that could be, upwards of 200 a month. That's a higher volume than norm for them, but so that's something that they had to adjust to kind of get used to.
Hmm.
But there's also this sort of provider practice. Different providers handle these things differently, when they're not in the network. Some will bill the insurance company direct and then kind of let the claim be adjudicated, and then what comes back, they'll bill the member or the patient. Others want the patient to pay up front, and then
Right.
then it kind of goes through that process of the member, the patient has to submit and get that into the system and that sort of thing. There's a mix of that in our experiences, but our members' experiences. But there's a lot, especially with behavioral health, that part. A lot of those providers, they just want to be paid up front. It's not a judgment statement; it's just a reality.
Hmm.
And that means that members have to do that work up front. They've got to fill out the forms. They have to get it in there so that Quantum and Anthem and Cigna know that a claim happened so they can do their work. So back to this paper, with Mayor Ben and early on and some of the machine readable issues that created unnecessary and really, to me, unacceptable delays in the process. And that hurt our ability to kind of get in there and get that stuff right away. So some of our members would call Quantum and say, I submitted this sort of thing, and the Quantum care coordinator is like, I don't see it. And so, well, that's because it didn't get into the system yet. So this is something we were like, we've got to fix this thing. We got to get this thing where it needs to be. Fix the commitment, which we have now on the current state, is all the PDFs in Maribin are machine readable, and commitment from Quantum and Maribin that now they're monitoring. So if there's something that's input for whatever reason, it kind of gets kicked out, Quantum will see it. They will manually enter, so it goes into the system, and we're tracking that stuff on a normal basis. We have insight into that now. And we have the commitment from, the president of Ameribin that we will get to this full electronic online solution. So,
Good.
so now I want to switch gears to, I think we're still good on time, right? Switch gears to the reimbursement side of this, because here's where we get into, the coding issues that, and I want to explain that a little bit without going into too much detail, but I think some of it's important. I mentioned before that our reimbursement levels are significantly higher than industry norm. We made the decision and continue to set our reimbursement levels at 285% of what Medicare would sort of approve. The industry is somewhere, like, I would say, average around 150. It'll differ by geography, it'll differ by health plan and that sort of thing, but at, say, average of 150, it probably ranges from 120% to up 190 or something like that. We wanted to go higher for the reason I said before. When there's gaps there, we didn't want to have an undue burden on our members. So we always paid at 285, and that means, there's a very simplified example that, let's say there's a 30-45 minute office visit for behavioral health, and that a bill charge from the provider might be something like $250. That's something that I would see, and Medicare would probably approve something like 100. When there's all these different codes, but when you look at like an average visit, it approves something like 100. So we would approve, we would pay at 285, so up to $285, and in this case, it would cover that whole 250. The industry, and if you were in a sort of a local sort of plan, you would experience, our members are sort of experiencing some of that, where the reimbursement rate is going to be lower, say at 150. So that's $100 difference that, all else equal, the provider is going to look to get that, from the patient, or unless they decide not to charge that whole thing. So that's what our clients are experiencing, not the 285. And that was both in certain parts of the Anthem, because Anthem is a kind of a compilation of these different Blues networks, and some of them were coded at 285, but many of them are not. And the Cigna system was coded at 195, not at our intended 285. So we didn't make those corrections. Ameribin and Allegiance, they're now correcting the system, and we're started the reprocessing. We had to go back and reprocess all this sort of stuff. And now I want to talk about some numbers around that. So, this is when we look at total members impacted. I mentioned, we have 22,500 members. We had, around 700 of our members were impacted by this, reimbursement, the coding error, sort of say. And then on average, that was about $300 of needed to be corrected. So I'm waiting for $300 back, reimbursement. That's an average. Now, averages don't mean everybody's doing the same thing. Now, I mentioned, are 700 members. There are members that have multiple claims, multiple out-of-networks. And just think about it, if I'm going to see a provider, I may be going there every month. So I'm going there 6 times. So even though in my example, it may be $50, $100, you get up to 6, some of our members are waiting for $1,000+ back on reimbursement. Unacceptable, painful. That is where I feel most, pain about and stress of. We've got to get that fixed very quickly, and that's where our focus has been. So we have got all the signas have been reprocessed. Most of the Ameribins have, but I mentioned before that we have some of these forms that got kicked out. That's where there still are some remaining ones where we have Quantum and Ameribin working together to correct all those forms and reprocess all that, with the commitment that that'll be done, next 2 weeks. They're working on it now. They worked all weekend to identify. Now it's processing that last group that we had to correct some of the forms and not put that on the member to do it, but our vendor partners to get it where it needs to be.
All right. Thank you, Frank. So what gives you confidence that we're turning a corner with this? What comes next?
Yeah.
And most importantly, because we're going to jump to questions from our members in a little bit, what might we need from our members during this time?
Yeah, thanks. Right now our areas of focus. So what comes next is sort of some of the stuff I talked about. But let me just highlight. We are focused now reprocessing those last. Those claims that the forms were not fully received for whatever reason, they were kicked out, that there still are about 100 or so of those claims that we need Ameribin work with Quantum to finish and get them reprocessed. That's that commitment that'll be done, checks in the mail over the next couple of weeks. So we're staying front and center on that as we monitor just the ongoing process. We're not taking a step back. We're not saying our work is done here. We're staying close and deep on this to make sure that we have full insight into what's going on as we work with Ameribin to get to that full e-solution on the process piece of it. We will be doing a full claims audit. So this is sort of the belt and suspenders piece that we are going to hire a third party. Now, when we do a claims audit, that's looking at, and we're doing a full claims. We're looking at everything. We're going to start with out-of-network for members that saw out-of-network providers, but we're going to do everything in network as well, just to make sure that nothing was missed, and that sort of like kind of closes the year in terms of, okay, we see what's going on. We're making these changes and fixes in the moment, but we want to make sure that nothing else is, sort of slipped through there. And then we're going to, not today, but soon, we're going to sit down with our, our contacts at Quantum, Ameribin, Allegiance, and us at CBG for true lessons learned. Let's sort of unpack this further so that we really learn from this. We identify opportunities to enhance going forward. And that's not just, these specific issues, but if something, how do we make sure that we catch whatever's sort of below the surface area more quickly, address, keep monitoring and make sure we're looking at the right stuff. So, your question about what gives me confidence is, it starts with, acknowledgement and openness with us and with our vendors, that, when we were like, okay, this is broken, there's a compound fracture here. Nobody was backing away from that. It's like, okay, let's figure this stuff out. That gave us the insight. Otherwise we would still be trying to figure out, with the hundreds of thousands of claims that are coming in, like, what is the root cause? So we know the root causes where we have dedication. I'm proud of, and the other thing that makes me confident is dedication, resilience of my colleagues. I talk to them a lot about, this is where we need to show up, and this is where we need to, failures aren't mistakes. It's how we respond to that. And we're staying in, and, we remind them, listen, we need to be resilient. We're going to get to the other side of this thing. And that's that level of engagement with our vendor partners too, that they're fully in there with us. They are not, we have the attention of, leadership in these organizations and acknowledgement that we need to get this to the intended place. So material progress looks good. We're not done, but also the commitment and shared accountability to not stop, to get this to full resolution. I think your last part was around clients and what can clients do. I would say, one, again, is thank you. Thank you for your patience and for reaching out to us, but just stay connected. We're going to do our best to stay connected. We're going to continue to communicate our intent and our progress, so that, we want you to know what is the expectation, and when it's going anywhere sideways of that, let us know. Let us know right away. And if you're letting us know and you're not sensing that we're hearing, then find another way to get to us. Just make sure that you reach out, to Quantum, reach out to us and just say, hey, I heard what you were saying. I'm not experiencing that, or there's just more here that, I need to understand about this, so that we can get to that intended, full, improved client experience.
Excellent. Thank you, Frank. We received many questions in advance of the webinar, and we want to thank those of you who spent the time to submit them. Some of you have already received responses from a member of our team. We've covered quite a few of those questions in this interview session. Frank, I want to, because there are some questions coming in on the chat, have you speak really briefly about and address United Healthcare, because we are getting a lot of questions about that. If you just make some brief remarks about that. And if you are wanting to ask a question, please raise your hand if you're wanting to go live. Thanks, Frank.
Sure. Thanks, Arlette. Yeah. So we noticed that even in the pre-questions, there's we have our retirees reaching out and some questions about United Healthcare, about the group Medicare Advantage plan. I should have been clear up front, I guess, on this one. This was really about our active clergy and lay employees in the denominational health plan and in in schools and other institutions. But we also own the experience on, for retirees, and we are separately doing, other research right now to be looking at, is this the right, are there opportunities with the group Medicare Advantage? Is United still, the right answer for us? That will not change for 2026. We don't have the time to do the proper due diligence with that, but we are starting some of that work so that we will be able to, take in a lot of, feedback from our retirees and look at the industry, see where things are at, and see if this, is the right solution going forward, or any things we can do to optimize that as well.
Okay, thank you. So now we're gonna open the mic for anyone with a question that we haven't yet addressed. Please raise your hand if you have a question. I want to remind you that this webinar is being recorded and will be posted on our website at a later date. So please do not share personal health information for yourself or that of anyone else. Please focus your questions on Quantum and this transition. For other benefits related questions or concerns, feel free to email us at benefits@cpg.org. I believe that email is also in the chat. To give as many people as possible a chance to speak or to ask their question, I'll ask that you keep your question under a minute. If you go on for too long, I've promised Frank that I will start singing or humming, and nobody wants to hear that. But that said, we know that emotions are high with some of the issues that we've been experiencing. Things are not going as we would like. So my final ask is that you are respectful and that you are kind in asking your question or making your comment. Frank is here to listen to all questions and to respond as best as he is able today. And if you absolutely have something that you need to get off your chest, that email as well, benefits@cpg.org. Send us an email. Someone will contact you and will engage with you. All right. So Jermaine, I think Frank is ready for his first question.
Sounds
Do we
good.
have anyone?
Yes, we do. Sounds good. Linda, I am now allowing you to speak. It looks like you're muted. If you just unmute yourself, you have speaking privileges. Once again, Linda. All right, Linda, we're gonna give you one more second and then we can come back to you. Now, Edwin, you are now allowed to speak.
Will Quantum have any role for retired who are under United Healthcare?
Thank you, Edwin. Quantum is aware of our programs for United and group the group Medicare Advantage plan. So they're there to answer some questions. We do have some programs for retirees that that Quantum reps will make you aware of. So the short answer is yes, you can reach out to Quantum for that. It's not the same. It's not the same level of the involvement that they have with the active populations, because the group Medicare Advantage plan is handled differently than the active plans.
So for retirees, nothing changes about our process or who's in network.
Correct.
Okay, thank you.
Correct.
All right, thank you, Edwin. I am going to now go to Derek. Derek, you are unmuted.
Hi, I am wondering, first, I appreciate that you're doing the webinar and that you try to make yourself available. I'd like to point out that I have been in touch several times by email and been ignored for more than a week at a time, including Mr. Armstrong was on these emails, and Ms. Wold, and other people, to the point that I've been in contact now with the CEO of, or the president of Ameriben directly. And I'm just wondering, at what point do we know that the corner is going to be turned and that we're going to get the claims that we continue to submit? So I have monthly claims that I submit every month, and every month has been processed for a different reason incorrectly. How do I know that when I submit at the end of July, my July claims, that they're going to be submitted correctly, especially since the past month's claims have been rejected because of, quote unquote, using the wrong form, which was emailed to me in a link by John Servais from CPG, and the content of the form, which Karen from Quantum said to me, was literally no different than the mailing address on the form, but I submitted it by email.
Thanks, Derek. And yes, I saw your emails from last week, and we are working on those. Your experience is, like I said, 180 of what was intended. So all I can say is that don't feel good about it, and we will make sure. What you're just saying is that everything is corrected and the go forward is also on the right path. I mean, all I can say is that that's what I'm saying. We're staying on this. We now know the root cause of what everything's going on. I apologize that I am aware that even in some of the correspondence, it was sort of like, well, even in there, it's like, well, it felt like, oh, we're blaming the member here. And that is not the intent. It was sort of like, this thing is broken. We're trying to fix it. And, we're moving to get there. And, I apologize for your experience. That it's just not, is just not what is expected, and it's not acceptable. And we're going to move forward in a different way with that. We will make sure, not just yours, but that's why I said we have the relationship, we have our contacts with Quantum, Ameriben and Allegiance, making sure now that we have full insight into this, we're monitoring it, we're making sure that the corrections are made and that the experience going forward is back on track of where it needs to be.
All right, thank you. We will now go to Elizabeth. You are now have speaking privileges. Now, Elizabeth, we just need you to unmute on your end.
Okay, now it's okay.
There you go. Yep.
Thank
Perfect.
you. I live in Rhode Island. I'm retired, and United Healthcare did not successfully negotiate an agreement with the Brown Health Medical Care, which now controls all of the hospitals. So I cannot go to a hospital in Rhode Island. And is Quantum able to help me navigate the problem? That I can't have any testing done, blood tests, mammograms, or anything through a center that has Brown Medical, because United Healthcare did not reach an agreement with them. So I just want to encourage you to find another provider than United Healthcare.
Right.
And good luck on your search. And I'm prepared to have to travel quite a distance to Massachusetts for my care, but it does seem a little outrageous that that's permitted to happen to somebody that through whom I get my health care.
Yeah.
Will the Quantum help me with that, or do I have to go through United Healthcare to get out of
Well,
service or whatever, out of network help?
Elizabeth, let me take that one with my team and sort of get back so that you're not.
Yeah.
We'll take that and get back to you because I have been aware of, the Brown, negotiations, those sorts of things with United, and these things pop up.
Yeah.
But I don't want you, I mean, feel free to reach out to Quantum. I'm not telling you don't do it, but let me do some work here first, and we will get back to you on this one.
Appreciate it. Thank you.
All right, thank you. Next, forgive me for the pronunciation, with all respect, but Tibia, you are now unmuted.
Hi, yes, Fabia. That was,
Fabia.
at least you tried. Thanks. No, I really appreciate you all taking the time. I think my experience has been everything from the adjusting my out-of-network rate to Medicaid to like delays in getting checks to now I'm just not getting reimbursements. And so I think you covered most of it. But I think the one thing that hasn't been covered is my experience is now with my in-network provider as well. So I'm having all the issues with my out-of-network, and I feel bad for the folks at Quantum. They can't see what Allegiance can see. Allegiance is clearly processing the claims incorrectly, and it seems like all Quantum can do is kick the claim back to Allegiance, and they're frustrated. I'm frustrated. I feel really bad for them. But now my in-networks claims are being kicked back, saying that they're using the wrong code, which is what I get when I submit my claims for my self-pay. So I don't like it. Just seems it almost seems like it's getting worse. It's not just in-network. I mean, out of network now. It's in-network, and it went from me not getting the right reimbursement amount to now they're just telling me that I submitted the claim wrong. They're telling my provider they're submitting the claim wrong. So it's getting worse and not better.
Okay. Well, sorry about that. So I will have our team look into that one because I just really need to understand, the root cause of that to again see what's going on. I mean, I will say this is why Quantum exists. This is why we brought him in, to be able to, have these conversations. I mean, I just want to say again, yes, facts are that Quantum is not the claims processor, but you will see explanation of benefits, on the site on Quantum, because we want that one stop so that they will have conversations and sort of bring this stuff together. Of course, my neighbor's landscapers are going on. Hopefully that's not too much of a buzz here, but we will. I want to look at it in network because sometimes, I mean, providers do put wrong codes in there. I mean, some of this does happen. Like I mentioned before about the complexities of the healthcare system, you have the doctor, you have people in the office, some of them use third-party billing companies, and it doesn't always work, but that's why Quantum exists. And, they would say the same thing that I am, that's why they will step in to help you through this. And so I want to trace this one through a little bit forward to understand better why you're not experiencing as intended, and we will circle back.
Perfect, thank you. And now, Reverend Canon John, you are able to speak.
Hi, yes, Mr. Armstrong, I have a bigger picture question. It seems that the maybe the whole or sole purpose of this call and these changes is the addition of Quantum Health to our coverage in our system. So I know historically these kinds of things happen from time to time with claims out of network claims, so on and so forth. But it sounds like to me, or it seems like the big problem here is Quantum. Can you answer that simply, yes or no?
The answer is no to that. It's not Quantum. The answer is no. But the move, our decision to move in this direction is bringing a lot of positives, but had these unintended issues that popped up in implementation that we are going to work through. We're going to get to the other side of them so that, and that this all, I mean, we just have to do it and show that like we realize the benefits of what quantum brought, everything I talked about, so that we can get to that optimal intended experience. We still feel strongly that it's the right solution, but we need to get to the other side of some of these issues.
So the difference between last year, as an example, and this year is quantum. We didn't have a call like this last year. So I don't understand how it's not quantum.
Well, again, remember the two new things were quantum, and we changed the claims engines that we work with for Anthem and Cigna. So I'm not putting the cast of blame on any sort of one, but it's those things together that there's experiences here that are not playing out as expected, and we are on it to get them to the place where they should be. I will tell you that there are other organizations, including peer denominations, that work with quantum and also with Anthem and with Cigna in these, and they work. We have to figure out and just get to the other side of why some of these things, again, some of these were coding. They were not coded correctly in the system. Once they're fixed, they should be fine. The other thing is around Ameriben, and that process is just wasn't where we needed to be, and there is still more work to get it there. So we need to get to the other side of this thing, and we will keep you updated on where we are and how we're feeling about this. And we should see that this thing's going to play out as intended. Of course, if we don't get there, we need to get through this stuff so we can really say and play back and all of our clients experience what was intended here.
Perfect. Thank you, Frank. Arlette?
As Jermaine tries to unmute the next person, Frank, can you talk a little bit about GLP-1 medications and the use of Omada? We had a question about that.
So GLP-1s, these for those that don't know, these are these are drugs that help a variety of things, from weight loss to other conditions. We still cover them. We've covered them before. But moving into 2025, this is a decision we did make. This was not a quantum decision. It was not a Anthem or Cigna decision. That as the industry develops with GLP-1s and their efficacy, we wanted to make sure that our members had access to for the right clinical conditions. We followed the federal standard medical necessity guidelines so that members that have conditions that need this drug, they get it. For those that are using it for weight loss, we put Omada in the program that helps in addition. So we want you and need you to sign up for that so you can treat, learn and get a health coach around other thing, as well as a step to being eligible for that program. That is something that, Medicare decided, they're only going to, cover them for, certain conditions, if you have diabetes or others. Of course, we cover it for that. We also cover it for, some forms of obesity, but ones that don't hit certain markers, we want this program because guidance tells us this is the way to go about this stuff. So we didn't do what other organizations do and just say we're not covering it. We're thoughtful about how do we continue to make this available for those who are most need, and do so in a way that is cost effective for the overall program.
Thank you. All right, Frank, we are at time. Do you have any closing remarks for our members?
I guess just again, thank everyone who spent time, your investment in time with us, for your candor, for sharing with us. I have a pretty thick skin. I prefer you just tell me like it is, and my commitment is that we're going to get to the other side of this stuff. I'm thank you for your patience as we work through remediating these issues. Again, I want to acknowledge and regret the unintended impact of some of these changes, especially with the out-of-network experiences. We know we have more work to do to rebuild overall confidence in the solution that we put out there, but we remain confident in the program. We're going to continue to provide updates, written communications on keeping our members informed and updated on what we're doing so they can see us getting to the other side of some of these issues. I would say just in the meantime, just don't hesitate to contact Quantum or us directly if I didn't answer your question, if something else comes to mind when we hang up, or if just anything new arises. I mean, we have different ways to get to us. Please don't hesitate to reach out.
Thank you, Frank. Thank you, friends. God bless.
Thank you.